Hi, everyone. I'm Emily McManamy with the University of Vermont Health Network. Thanks for joining us tonight. I'm with Dr. Rebecca Bell. She's a pediatric critical care physician at UVM Children's Hospital and the president of the Vermont chapter of the American Academy of Pediatrics. She will be answering questions about how to keep your kids safe during this busy respiratory illness season and when to seek care should your child get sick. Dr. Bell, thank you for joining us tonight.
Thanks for having me, and thanks for everyone who's joining. I know it's a busy time of the evening.
Let's dive right in. What is RSV? What is it all about?
Yeah, so lots of people are hearing about RSV in the news. And so I'll talk a little bit about what it looks like and how it affects children. So RSV is respiratory syncytial virus. It is a very, very common respiratory virus. In fact, we have all had it. And we really think that most people have had it by the time they're 2 years old. Usually that first infection is a little bit more intense or serious, but it's also an infection that we can get over and over again. So we can get reinfected throughout childhood, we can get reinfected in adulthood. Usually that first infection, though, is the most severe infection. So in most people, even in children, even in young children, it's more like cold-like symptoms. So it affects the upper respiratory system. So stuffy nose, congestion, runny nose, cough, fever sometimes. That's pretty common. But in some folks, especially in young children and little babies, what we see is lower airway involvement. So that infection can actually affect the lower airways and the lungs. So it can cause inflammation of those small airways. So if you think about the picture of the lungs and the airway and how it branches off, and thinking about those little branches are called bronchioles. And they're really small in small kids, and they can get inflamed and sort of filled with some mucus. And that can cause a lot of difficulty breathing, potentially. Can also affect the actual lung tissue and cause pneumonia. So that's what we see in kids and small babies. The other thing it can do, like every virus, it can trigger an asthma exacerbation in children or young children or older children who have underlying asthma. So that's another thing that we can see is really this asthma exacerbation that was triggered because of the RSV infection that caused that sort of tightening of the bigger airways. And then I'm not going to talk about it too much, but I do want to acknowledge that older folks can get very sick from RSV, and that it is a common reason for people older to be admitted to the hospital and to be pretty sick. So it's really those extremes of ages where we see people most affected by respiratory syncytial virus. And I would say that, again, thinking back, okay, so pretty much everyone's infected by the time they're 2 years of age. That means millions of kids every year, young children, are infected in the US. And about 1% of those, especially the young kids under the age of 6 months, end up needing to be hospitalized. So 1% doesn't sound very high, but since so many kids are getting it, it ends up being tens of thousands of kids. About 60,000 kids under the age of 5 get admitted to a hospital in the US every year just due to respiratory syncytial virus. And it's a common reason in Vermont and New York to be admitted to the hospital, either to the pediatric floor or the pediatric ICU. So this is something that for any medical provider who cares for kids, it's something that we see a ton of. And we've been seeing, we see a lot of it through our careers, and something we're very, very familiar with.
Is RSV more severe this year?
So good question. So we're hearing a lot about RSV, this RSV season being unusual or very busy. It is not, what we're seeing is not more severe than we have in the past. We're just seeing more children getting RSV. And so I'll talk a little bit about why that might be. So our respiratory season typically is pretty predictable in terms of when we see it. So RSV used to be very predictable. We would start to see it in December, we'd be very busy in January, February, and March. and then it would sort of start to taper off. So those 3 months were the busiest months. We really didn't see RSV in the summer. And so we would be prepared knowing that we were going to have a lot of children in the hospital for RSV during that time. We sometimes see influenza and other viruses during that time. So going back to March of 2020, when COVID mitigation strategies were enacted, everyone was told to stay home. We were in the midst of a busy RSV season and flu season at the time. We were really busy. All of a sudden, with the when we enacted those measures, RSV went away, flu went away. We did not see it. So that season was sort of cut short. And then we did not have any RSV the following winter. So that winter of 2020 to 2021, we didn't see it. Coming up on the following summer, the southern states saw RSV, and we saw it last year in Vermont in the fall of last year, which is unusual to have it in the fall. So we saw some cases in November, in particular, November, December last year, we had some cases, but not as much as we normally would, not as much as a regular RSV season. It was probably like a third to a half of the cases of what we would typically see in the winter. When the Omicron variant came through, really RSV seemed to go away, and then we've been seeing some cases this summer, and now we're seeing a lot. So the question is, why are so many kids getting it? And again, most kids usually get it by the time they're 2, but now we have about 2 years worth of children who haven't gotten RSV over the course of about almost 3 years. So we have the infants that get the most sick from RSV and continue to get the most sick from RSV that we're caring for in the hospital. But then we also have 2, 3, 4, 5-year-olds who are seeing RSV for the first time. And for some of them, they might have underlying asthma. And so they're presenting with that asthma exacerbation and needing help in that case. So what we're seeing is not new, it's not different. It's not that the virus is different or that the kids getting it are different. It's just that we're seeing a lot of it all at once. And I really do want to distinguish the difference between what we're seeing at a population level and what we're seeing at an individual level. So at a population level, we're seeing the number of admissions that we would see in the busiest winter time. So in a typical year. So it really, to us, feels like February right now. I know it's warm outside. To us, it feels, we go in the hospital, there's so much RSV, there's so many kids in there with RSV, it really feels like a typical February. So we're seeing our peak winter numbers right now. That is putting a stress on our system due to a number of reasons. But at the same time, if you are a parent and your child gets RSV, there really is no difference in terms of, the course that your child will have. It's not that the virus is worse now than it has been. It's just at a population level, it's putting some stress on the system.
Okay, thank you. Before we get into how parents should be aware of symptoms and what they should do and what sort of care they should seek, can you tell us a little bit more about what you're seeing at UVM Children's Hospital?
Yeah, sure. So I'll back up a little and say that actually in August, before school started, we were actually seeing a lot of kids, more school-age kids and toddlers who were being admitted for rhinovirus, which is another very common virus and a virus that we actually saw a lot of during the pandemic. It's a very persistent virus. So we were pretty busy in August with rhinovirus. And then started seeing RSV in September, and now those numbers have grown. We're still seeing some rhinovirus as well. So those are the 2 viruses that we're seeing right now that are landing kids in the hospital. We're not seeing COVID in pediatric patients in the hospital at this moment, and really haven't for some time. Influenza, however, is just starting. So we're just starting to see kids getting sick enough to need to come to the hospital with influenza A. That is coming, and something we need to definitely spend some time talking about, because that's a big worry of mine, is what the influenza season is going to do. So that's what we're seeing at our hospital. Now, we're usually a few weeks behind, say, the southern New England states. And because there are not a lot of pediatric intensive care units in New England, we are in close contact with each other. And so what you may be seeing in the news is a lot about what's happening in Southern New England, which is that there's a real pediatric bed crisis in Massachusetts and Rhode Island and Connecticut, especially. And some of that has to do with just the number of children with RSV, mostly, some also with rhinovirus, who need to be in the hospital. And in that area, there have been, unfortunately, pediatric hospital closures over the last year and pediatric intensive care unit closure even. So even though that has happened hundreds of miles away, and we have been lucky up here, we've preserved our pediatric hospital capacity, but that ripple effect we can feel because, again, if children need a place to go, they're going to have to go to a different hospital in the region, and then that sort of works its way up to us as well. So we are learning a lot from our Southern New England colleagues. Our health network is making a surge plan, a pediatric surge plan, because we are expecting that these numbers of admissions are going to go up probably over the next couple of weeks. We don't exactly know, can't model this out perfectly. So we are making plans for how we can accommodate all the kids in our region who might need care in the hospital or in the ICU. Right now, we're able to accommodate everyone. So we serve, Vermont, and we serve our patients in Northern New York. And we have been able to do that, but we are making plans in the event or the eventuality that we're going to need even more pediatric bed space for kids.
Now, I think in an earlier conversation I had with you, you said most RSV cases just require some home care. So as a parent, what guidance can we share with parents that need to help their kids make it a little bit more comfortable? How should they be treating this respiratory illness?
Great question. So oftentimes, actually, the first question parents say is, my kid has congestion, cough, maybe a fever. Is this RSV? Right? That's oftentimes the first question. I'm hearing about RSV in the news. I'm hearing kids going to the hospital for RSV. Is this what my child has? So the only way to know that for sure is to get a test for that specific virus. Just like any other virus, to know for sure, you'd have to get a test. However, we do not recommend testing, and that's because it doesn't change our management. So we wish we had a medication or some type of treatment that we could give to kids that would, alleviate their symptoms and make their RSV infection shorter and less severe, but there is no special treatment. And so we really don't recommend that kids get tested for RSV or for rhinovirus or the other viruses that I mentioned, because we're not going to do anything different with that information. So that's one part that's hard for parents to sort of sit with is, okay, my kid has these cold-like symptoms. Is it RSV? Is it rhinovirus? Is it flu? And really what we want to focus on is the symptoms that your child is experiencing and thinking about how, again, we can help them be comfortable at home, and then when to call your child's medical provider and when to maybe, go to the hospital. So I'll sort of talk a little bit about that. So when we talk about infants in particular, that nasal congestion can really make it hard for them to feed. And so that might be something, if you have an infant with a respiratory viral illness, they just might be congested, their feeds take a little bit longer. And that's okay if their feeds take longer, as long as they're getting what they would normally get. And one objective way to measure that is to make sure they're having their normal amount of wet diapers. And really, we want to see a wet diaper once every 8 hours or so. So that's one reason why young infants may need to come to the hospital for a viral infection. And that may be because they need help feeding, either with a tube or with IV fluids, if they can't stay hydrated on their own. The other thing we look for is hard breathing. And so what that might look like in your child is using a lot of extra muscles to breathe. So it may be neck muscles. You might be able to sort of see their trachea, their collarbone, their sternum when they breathe. You might see their head sort of moving forward to help them breathe. There nostrils flaring, and then their belly might be pulling in and pulling out, where to the point where you can really see their ribs or their chest wall muscles being used. And that's all part of them trying to like ventilate themselves while they've got that mucus and that inflammation in those lower airways and their lungs. And so in that case, you would want to be seen, and so you would call your doctor about that and have your child be seen for that. Other advice that my outpatient pediatric colleagues and family medicine colleagues will give families is really, because this nasal congestion can be just very frustrating and really interfere with feedings, is using some saline nasal drops. You can use gentle suctioning, like the nose Frida is a good one, because you don't want to traumatize their nose, but some gentle suctioning. Humidifiers can help there. And really it's a lot of it is just time. So the vast majority of even young infants will just be managed at home, and they may not even need to see their pediatrician at all. A few will need to see their pediatrician, and working through whether they need to be seen at the hospital is something that you can talk to your child's physician about. Again, this is something we see a ton of. So the pediatricians and the family med physicians in Vermont, in Northern New York, they have seen a lot of this over many, many years. And the nice thing, again, about this is that this isn't a novel virus. This isn't like when COVID-19 came and we were really learning a lot about what the virus does. We know what this does and we know what this looks like. But also we want to keep those lines of communication open. So just like any illness, just like any virus, it gets symptoms get a little bit worse and then they get better, right? So you might call early on in the illness and they may not need to be seen, or they may not need to come to the hospital. And then a few days later, you might notice that breathing that we just talked about. And at that point, they may need to be seen. That can be kind of frustrating for families because they think, I was just seen 2 days ago, or I just called 2 days ago. And again, it's not like a bacterial infection where if we diagnose it early and give antibiotics, you can change the course. Unfortunately, there's nothing that we can do to really alter the course of RSV. So it's not like we can catch it early, give kids something. We would love that if we could do that, and then make it better. So this is something that you want to just watch for those symptoms and be in close communication. It may be that they're okay, they're doing okay one day, and then 2 days later they need a little bit more help. But that can be very frustrating for families.
Thank you. If you're just joining us, we are in the middle of a Facebook Live with Dr. Rebecca Bell. I'm Emily McManamy from the UVM Health Network, and Dr. Rebecca Bell is a pediatric critical care physician at UVM Children's Hospital. She's also the president of the Vermont chapter of the American Academy of Pediatrics. If you have questions, we are taking questions. Please post them in the comment or chat section on Facebook, and we will get to as many questions as we can tonight. My next question in our final 10 minutes, I'm hoping you can give families some advice as to how to avoid RSV with their infants.
Yeah, great question. So I think, again, everyone kind of gets RSV generally by the time they're 2 years of age. It's a big difference if you get RSV when you're 2 years old compared to when you're 2 months old or 2 weeks old. So it is really worth trying to avoid and delay infection in those small infants because they are the patient population that gets the sickest. Okay, so how do you do that? You're a parent of an infant. First of all, congratulations. And it is challenging to have an infant during RSV season. But we have some practical advice, and this is the advice I'd always give families even before the pandemic. And hopefully people are a little bit more understanding, having gone through this pandemic and thinking a little bit about being more self-aware about transmitting illness. Okay, so how is RSV spread? This is kind of similar to flu and some of these other viruses. It's different than COVID. So it's not airborne or aerosolized, and instead it's through contact. So touching, RSV can live on surfaces, like especially hard surfaces. for a little while. So touching a surface and then touching your mouth or your nose or your eyes, you could transmit RSV. And so that's the most common sort of this contact, touching somebody else, and touching yourself. And then the other way is through droplet, but like kind of close contact droplet. So certainly coughing on someone's face or sneezing on someone's face can transmit droplets. That can transmit RSV. Okay, so first of all, what I recommend is during RSV season, really limiting visitors if you have a new infant. So especially under, really under 6 months, especially under 3 months. And it's really tough when your baby's born, you go home, it's the middle of RSV season, and like everyone wants to come over and hold your baby. I would say no. And what I would say is this is a temporary time. Like, we're in the midst of RSV season. We're going to be out of it in a couple months. Let's just hold off on that. What about people who are helping you and you need help to care for your infant? You've got the grandparents, or you've got a child care provider who's helping. How can you help minimize RSV transmission? Hand washing. It's something that, wasn't as important for COVID. It is very important for things like RSV and flu. So setting it up, like hand sanitizer, around your house. You've got like opportunities to wash your hands. So really, really washing your hands. Wearing a mask can help if you're going to be in close contact. Let's say you're a caregiver, you're a parent and you feel sick and you have to care for your kid. You could put a mask on. That would help, create a barrier so that there's no droplet exchange. So, and then Thanksgiving is coming up. And so what I would really recommend is really limiting gatherings. And it's really about other people touching your infant. It's less about sharing air like in COVID, and it's more about not having all kinds of people touching your infant. So think about how you might want to navigate that. I used to do with my, one of my children was born in RSV season, and I would just always have him in a carrier and just say, "Oh, I'm sorry, he's trying to sleep, so we're not gonna." And that would be my excuse for why people couldn't hold him. But hopefully now, again with COVID, there's more awareness, and you can just say, "Hey, it's RSV season. We're not gonna do that." So then the next question, and this is a really common thing, is, okay, let's say you're a parent of a 1-month-old and you have a 2-year-old. Tough times. It's a tough time for you, but it's a very common scenario. So what do you do with your 2-year-old, right? Your 2-year-old's in childcare, and they need to be, because you need to, that's a good place for them to be. But how do you manage them in the house when RSV is all over the place? So again, talking a lot about hand washing. And then I really have parents talk to their toddler about ways that they can help. That's not kissing their sibling, that's not putting their hands over their sibling's face, and not touching their hands. So, if you think about an infant, you grab their hand, the next thing they like to put their hands right in their mouth. So we talk about with toddlers having them play with their siblings' feet. So helping to put on socks or booties, helping to put on pants, you can hand them diaper, you can help out with some of the care, but really around like the feet and not so much the face and the hands. And then we always recommend that you can get a doll for your toddler and say, "I'm feeding my baby. Do you want to feed your baby now? I'm going to change my baby. Do you want to change your baby?" And this involves your toddler without, and keeping some space between your toddler and the infant. And this is just, again, it's temporary. It's during RSV season. This isn't forever. But it's kind of a way that we can sort of manage keeping those infants in those first few weeks, a little bit in a bubble. And the last thing I would say to parents of infants is that even, if your child gets RSV, even if they don't need, and most likely they're not going to need to be in the hospital, it's still rough, right? There's congestion, there's cough. Kids after any type of viral infections can sometimes cough for a couple weeks. So the infants are kind of miserable. They're coughing, they're waking themselves up. They have disrupted sleep. And what I would say again is it's a really tough time. It is very temporary. This too shall pass. And a really important thing to remember is to continue all of those safe sleep practices. So it's instinctual to say, my child's sick, they're not sleeping well, I'm going to do extra things to comfort them, and it may lead to unsafe sleep practices, which is not healthy for the child. So what I just remind parents, a flat surface on their back. So don't, even if they're congested, we're not going to put them in an incline and let them sleep on those inclined sleepers. We want to put them down on their back in their own safe sleep area that has no, bumpers or pillows or blankets or toys. So that piece is really important. I think, getting help and just understanding that can be a tough time when kids are sick, but we want to make sure we continue our safe sleep practices.
Thank you. We did receive a question, but I think you may have just answered it. Kelly asked, I have childcare and all my kiddos are under 4. Is there anything special I can do to help keep them more healthy other than daily cleaning? So if there's anything you would add to what you just said, but I think it was really helpful guidance about how to juggle multiple kids in the same household.
Yeah, so I think again, it's really the infants in particular that we really want to do what we can to create this bubble around during RSV season. So and so it depends on the age. I didn't catch the age of your kids. Kids are under 4. Yeah. So and it's hard. So another thing, this is a great question because we've not seen much respiratory viral illness, like I mentioned, during the pandemic. And so parents of young kids, a lot don't know that it's very common before the pandemic to have a cold a month, sometimes concentrated in the winter for these young kids. So it's about 11 separate infectious episodes a year. Kids under the age of 5 have about 50 separate infectious episodes. So it is very common to get exposed to these viruses and to get sick from it. And so we want to minimize it, but we also know we're not going to be able to avoid it completely. Mm-hmm. So the hand washing I mentioned, some kids might do well with a mask in terms of, again, like having that barrier there so they're not touching something and then touching their face. So your kids the best. And that might be something that really can help them not, inoculate themselves with all the things that they touch. Depending again, how old your kids are, if they're very young, sometimes kids then actually touch the mask a little bit more. So it just depends on your kids. And then I do want to make sure I mention there are 2 viruses that are circulating right now that we have excellent vaccines for. And so this is something in your control that we can do to minimize pediatric illness. And that is COVID-19 vaccines. So although we're not seeing a lot or really any pediatric COVID-19 in the hospital right now, COVID is unpredictable. And, the kids that I have taken care of with COVID who have been in the hospital have been unvaccinated. We know the vaccine works really well against severe illness. And so getting that primary series in those kids under 5, if you haven't done that yet, I would get that started or finish that up. And then anyone over the age of 5 is eligible now for the updated bivalent booster, which covers the ancestral strain, but also this, what's circulating now, the Omicron strain. So I would recommend getting up to date on your COVID-19 vaccines. And then the really big one right now is influenza. I mentioned we're starting to see influenza now. The southern part of the United States has a ton of flu right now. So we are going to start seeing it's going to go up and up and up and up over the next few weeks. It's a little bit earlier than we're used to. So flu vaccine this week. I would say a good plan for this week is make sure you vote. Make sure you get your everyone in your family the flu vaccine if you haven't yet. So the question is, where can you get the flu vaccine? And outpatient practices right now that see kids are totally swamped because there are just so many kids that need to be seen. And so if you have an appointment with your child's doctor already, you might be able to get the flu vaccine then. Many practices are having a hard time making those extra appointments for flu vaccine. So you can call and ask. It may be tough to get one soon. Pharmacies will vaccinate kids 3 years old and up. And then the state has walk-in clinics, and what we can do is put in the chat the link to the walk-in clinic schedule, and they will vaccinate kids 6 months and above with the flu vaccine. They also have the COVID vaccine as well. But if you just need the flu vaccine, you can go just for the flu vaccine. 6 months to 65 years, they can do that. And the good news, there is some good news, which is that the current flu vaccine, the one that we have, is a very good match for the circulating flu strain. So you know how some years you hear the flu vaccine is good and other times it doesn't match so well. This year it matches really well. And we know this from the experience in the Southern Hemisphere in Australia. They had a busy flu season. Again, our population generally hasn't seen a flu in a couple of years, so we're actually expecting a lot of flu. They had a lot of flu cases, but the flu vaccine really did work well. This is a year to get the flu vaccine. I know I just heard our Vermont numbers earlier today from the health department, and our flu vaccine uptake is lower than it's been the past couple of years. So I'm really recommending that everyone get their flu vaccine. Those are two, COVID vaccine, flu vaccine, those are two things that you can definitely do to help reduce illness in your children this season. The other thing I would say is that because we are seeing these viruses trigger asthma exacerbations, that if your child has ever been diagnosed with asthma in the past, now is the time to talk to their doctor about what asthma medications they should be on heading into this season. So I'll give you an example. We're seeing lots of kids who were diagnosed with asthma some years ago. They were on an inhaled controller, an inhaler that they take every day or twice a day to kind of help keep things under control. But then we didn't have a lot of viruses. They weren't really getting sick. And so they were able to stop those inhalers. But now they're getting these viruses and they're having serious asthma exacerbations. So I would get back on those medications. If your child has come off of them, I would talk to their doctor about what medications they should be on, because that will also really help keep them healthy, because they're going to be exposed to a number of viruses this winter.
And one more piece of good news, children and adults can get the flu and COVID vaccine at the same time. I was thrilled to learn that when I took my son to get his COVID booster. They put one in one arm and the flu in the other, and off we were. It was easy.
So much easier. Yes.
I do want to be mindful of time, and we do have one more question for you. And this is a specific one. Someone wrote in, is this changing the state's programming around Synagis?
Great question. Yes. So
and what is Synagis?
Yeah, sure. So Synagis is the brand name of palivizumab, which is a monoclonal antibody. And we use this monoclonal antibody in infants who are at high risk of severe RSV. So I had mentioned those kids that are high risk, especially they were born premature, if they have, and not just they were born premature, but very, very early. Their lungs weren't fully developed and they have residual lung disease. So these might be kids who spend a lot of time in the neonatal ICU. They go home on oxygen, for instance, and they need to be on oxygen. So they have underlying lung disease, or they have certain serious types of congenital heart disease. So there are very strict criteria for who is sort of the most at risk and who may benefit from this monoclonal antibody, Synagis. The way it works is that it's an injection. It's given every month to those who qualify during the RSV season. So what this person I think is probably referring to is, because the season is a little, usually we start it in November, and we give it through, I don't know exactly when, but at the end of RSV season, sort of depends on what we're seeing. So yes, we did start giving it earlier this year because the RSV season is happening earlier. So yes, thank you for that reminder. And I think most infants or families that qualify for this, they're followed by subspecialists, or they're leaving the NICU now, and so this will be a discussion. So the problem with the monoclonal antibody is that what it does is it gives some kind of passive antibody, and it helps reduce a little bit the severity of RSV. It doesn't prevent infection, and it's not a perfect medication, and so that we really only see benefit if we give it to those most at high risk. I will add one piece of good news, which is that forever we've been wondering, will we ever have a vaccine for RSV? And there is some really promising news out just coming out this week about phase 3 data on an RSV vaccine that looks pretty good. And the way it would work is that they give the vaccine to pregnant people near the end of their pregnancy. Because again, the kids that we're caring for who are in the pediatric ICU who need non-invasive and invasive ventilation, like they need to be on ventilators, they are 2 weeks old, 3 weeks old, 4 weeks old. They're very young, weeks old. And so we really need to protect babies who are born in RSV season really right away. And so they give it to pregnant people, and then they make antibodies, and then they pass it on to their fetus, and the baby is born. And it looks like the initial data looks like there's good protection in that first 3 months against severe RSV infection, and then it lasts even to 6 months. So we're going to hear more about that, I think, coming up. And that is really exciting news because we really got to figure out how to protect those like very, very young infants who are born during RSV season.
Wonderful. Thank you so much. I think we will end with one last question. You talked about home care and how to alleviate some of the symptoms of RSV. Is there any medication like Tylenol, ibuprofen that you would recommend?
Right. So for kids who have fevers, what we recommend is, so fevers aren't dangerous, but they can make kids feel really miserable, and adults. Yeah, they can make us feel really miserable. And especially for kids, if they're so miserable that they're not feeding well, then you can give medications to help with fevers. And so talking to your child's doctor about Tylenol. When they're over 6 months, that's when you can do ibuprofen. So yes, you can absolutely give those medications to help bring down fever. And that might just help the infant or the child feel a little bit better. Otherwise, there's really no, and believe me, this is such a common problem in kids that everything has been studied, different types of nebulizers and steroids and antibiotics and all kinds of different things. And sometimes when they're in the hospital, there are specific things that we can try to do, but there isn't a medication that really works in kids. It's really about time and sort of getting them through it. And what we do in the hospital is what we call supportive care. So supporting hydration status, supporting the breathing, supporting the ventilation, supporting oxygenation. So we're really supporting the child as opposed to being able to do anything that alters the course of the illness. So it is frustrating. And I think that's a big problem, is that parents are like, what can we do? And then it's hard for us because we would love to help them feel better, but a lot of it is time. And really I had mentioned just the saline drops in the nose and gentle suctioning, that can really work wonders for kids as well, especially the young kids.
Great. Thank you, Dr. Bell. This was very, very helpful. We had some great questions from the audience. So thank you so much to everybody that tuned in with us tonight. Again, this is Dr. Rebecca Bell from the UVM Children's Hospital. If you have more questions that came to mind, feel free to throw them in the comments section, and we'll see how best to answer them. But thank you, Dr. Bell, for joining us tonight.
Thank you so much. Thanks for joining, and hang in there, everybody.
Take care.
Bye.